All right, let's get right into it. We all think we know what a heart attack is, right? But what if I told you the story we've all been taught is really only half the picture? Today, we are pulling back the curtain on a medical mystery that's literally changing how doctors think about our most vital organ. Just think about that for a second. Everything we've seen in movies, everything we learned in health class, it all points to a clog, a blockage. But what if the real problem isn't a traffic jam in your arteries at all? This is the exact question that's been puzzling doctors, and believe me, it's leading to a whole new understanding of heart health. So, to really get a handle on this new twist, we first have to go over the classic story. The one we all recognize as a type 1 myocardial infarction, or MI for short. Okay, so over on the left, that's the villain we all know and love to hate, an artery just choked up with plaque. But what about the artery on the right? It looks surprisingly clear, doesn't it? So, where's the problem? The standard script pretty much goes like this. A piece of plaque that's been building up for years suddenly breaks open. The body, doing its job, rushes to form a clot. But that clot ends up being the problem, blocking the entire artery. Blood flow stops, and the heart muscle starts to die. Seems pretty straightforward, right? Well, not always. So if it's not always a blockage, what else could it possibly be? This is where the story gets really interesting. We move beyond simple plumbing and get into the heart's own energy budget. It's really a problem of supply and demand. I want you to imagine you're an ER doctor for a minute. A patient comes in, chest pain, shortness of breath, and their blood tests are screaming that the heart muscle is being damaged. All the signs point to a heart attack. But then you take a look at their arteries, and there's no big clot, no obvious blockage. So what on earth is going on? Well, this right here is what's known as a type 2 myocardial infarction. The damage is absolutely real, but the cause, totally different. It's not about a sudden blockage. It's all about a critical imbalance, a really severe mismatch between the oxygen the heart needs to do its job and the amount it's actually getting. Let's break it down like this. Think of a type 1 MI as a plumbing problem. A pipe is suddenly and completely blocked. A type 2 MI, on the other hand, is more like an energy crisis. The heart is just working so incredibly hard, or maybe the body's oxygen supply is so low that it just can't keep up. Here's another way to think about it. A type 1 heart attack is like a sudden catastrophic explosion at the city's power plant. A type 2 is more like a massive heat wave hitting that same city. The demand for power is so high that the grid just can't handle it, leading to a brownout. So what kind of stress is so intense that it can push the heart into a full-blown energy crisis? Well, it turns out it's not just one thing. It's a whole network of potential triggers. Just look at this map. This is not about one faulty pipe. A type 2 MI sits right at the center of this complex web of issues going on all over the body. It really shows you that what happens in the rest of your body can directly and dramatically impact your heart's oxygen budget. Some of the most common triggers are things you might not expect. A dangerously fast heart rate, for example, that just skyrockets the heart's demand for oxygen. Or conditions that slash the oxygen supply, like severe anemia, where you just don't have enough red blood cells, or hypoxia from a bad lung infection. Even something like major surgery or a severe infection like sepsis can be enough to push the heart right over the edge. Okay, so we've established the cause is different, but you might be wondering, does that mean it's less serious? This is where the story takes a very, very sobering turn. Let's be perfectly clear about this. Just because the artery isn't blocked by a big clot doesn't make this some kind of minor event. The research is showing that this other heart attack can be just as deadly. I want you to let this number really sink in for a moment. 5 years after having a type 2 MI, only about 1/3 of patients are still alive. This is not a minor issue. It's a major, life-threatening event that's tied to some really serious underlying health problems. And the risk doesn't just go away. In fact, if you have one type 2 MI, you're over 6 times more likely to have another one. It's a huge red flag that the body's systems are under some extreme stress. When you zoom out and look at the long-term risk of dying or having another major cardiovascular event, type 2 MI is standing shoulder to shoulder with the classic type 1. The danger is completely equivalent. So this raises a massive challenge for doctors, right? If the causes are different, but the outcomes are just as bad, how in the world do you figure out what's really happening so you can give the right treatment? I mean, you have to get it right because the treatments are completely different. For a type 1, you're rushing to open that blocked artery. But for a type 2, you have to treat the underlying problem, the infection, the bleeding, the arrhythmia. Getting that call wrong has serious, serious consequences. So it takes some serious clinical detective work. First, they use blood tests to confirm the heart is injured. Step 2, they hunt for that underlying trigger. Is there a bad infection or major bleeding? Third, they treat that trigger and see if the stress on the heart gets better. And finally, they might use advanced imaging to get a direct look at the heart and arteries themselves. And this case file shows you exactly why that detective work matters so much. This patient had pneumonia, which made doctors think it was a type 2 MI. But advanced imaging revealed the real culprit, a hidden plaque that had ruptured. It was a type 1 MI all along. And that discovery, it completely changed their treatment and, very likely, saved their life. So you see, telling these two apart isn't just some academic exercise for doctors. It is absolutely fundamental. Getting the diagnosis right means getting the treatment right. And that is the key to improving those terrifying survival statistics we saw earlier. It really makes you wonder, doesn't it? The classic heart attack is just one piece of a much, much larger and more complicated puzzle. And it leaves us with one final question. What other fundamental medical ideas that we all take for granted are just waiting to be seen in a completely new light?